Trolamine salicylate is a medication used to relieve minor muscle and joint pain, such as arthritis, backache, and sprains. It is classified as a salicylate drug and is commonly used for its analgesic properties. It is applied topically and should be used as directed by a healthcare professional. The recommended dosage and optimal timing for application may vary depending on the individual's condition and needs. It is important to follow the instructions provided by the healthcare professional or the product label for the best results. When using Aspercreme 10% topical, it's important to follow the directions on the product package. If you have any questions, it's best to consult your doctor or pharmacist for guidance. This medication is meant for use on the skin only, and should not be applied to the eyes, nose, mouth, or vagina. If accidental contact occurs, be sure to flush the area with plenty of water. You can apply the medication to the affected area no more than 3 to 4 times a day, making sure to rub it in gently and thoroughly. After applying, be sure to wash your hands, unless you are using the medication to treat your hands. Avoid applying this medication on broken or irritated skin, and refrain from bandaging or tightly wrapping the affected area, or applying heat. Doing so may increase the risk of side effects. If you have any concerns, it's best to consult your pharmacist for more details. If your condition lasts for more than 7 days, gets worse, or keeps coming back, it's important to inform your doctor. And if you suspect a serious medical problem, seek medical help right away. If your doctor has prescribed Aspercreme 10% topical, it's because they believe the benefits outweigh the potential side effects. Most people using this medication do not experience serious side effects, but it's important to be aware of the signs of a potential adverse reaction. If you notice blistering, peeling, redness, or irritation at the application site, or if you experience nausea, vomiting, or ringing in the ears, stop using the medication and contact your doctor immediately. While rare, a serious allergic reaction is possible. Seek medical help right away if you develop a rash, itching, swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so be sure to talk to your doctor or pharmacist if you experience any other unusual symptoms. If you're in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or online at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Aspercreme 10% topical, make sure to talk to your doctor or pharmacist if you are allergic to Trolamine salicylate, aspirin, or other salicylates, or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to discuss this with your pharmacist. Also, let your doctor or pharmacist know about your medical history, especially if you have asthma or nasal polyps. If you are planning to have surgery, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Aspercreme 10% topical is similar to aspirin, so children and teenagers younger than 18 years should not use this drug if they have chickenpox, flu, or any undiagnosed illness, or if they have recently received a vaccine. In these cases, this drug may increase the risk of Reye syndrome, a rare but serious illness. If you are pregnant or planning to become pregnant, it's important to talk to your doctor about using this medication. It may harm an unborn baby and cause problems with normal labor and delivery. It is not recommended for use in pregnancy from 20 weeks until delivery. If your doctor decides that you need to use this medication between 20 and 30 weeks of pregnancy, you should use the lowest effective dose for the shortest possible time. It is not recommended to use this medication after 30 weeks of pregnancy, so be sure to discuss the risks and benefits with your doctor. If you are breastfeeding, consult your doctor before using Aspercreme 10% topical, as it is unknown if the product passes into breast milk. When using Aspercreme 10% topical, it's important to be aware of any potential drug interactions. These interactions could affect how your other medications work or increase your risk for serious side effects. To minimize the risk, keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products. Make sure to share this list with your doctor and pharmacist. Avoid starting, stopping, or changing the dosage of any medicines without your doctor's approval to ensure your safety and well-being. If this medicine is accidentally swallowed, it can be harmful. If someone has taken too much and experiences severe symptoms like passing out or difficulty breathing, it is important to call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center for assistance. Remember, it's important to keep this medication out of reach of children to avoid accidental ingestion. Make sure to keep all your scheduled medical and lab appointments. This will help your healthcare provider monitor your progress and make any necessary adjustments to your treatment plan. It's important to follow up regularly to ensure you are getting the most benefit from using Aspercreme 10% topical. If you forget to use Aspercreme 10% topical at the scheduled time, apply it as soon as you remember. However, if it's close to the time for your next dose, then just skip the missed dose. Don't apply double the amount to make up for the missed dose. Make sure to store Aspercreme 10% topical at room temperature and away from heat. And as always, keep all medications out of reach of children and pets. When you no longer need Aspercreme 10% topical or it has expired, make sure to properly dispose of it. You can consult your pharmacist or local waste disposal company for the best way to do this. It's important to never flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.